Greg didn't mention what he's wearing on his bottom.
You can't.
So.
Yeah, I'm on.
Oh no, I got shorts on too.
I'm untucked.
I understand none of us are to stand up in the middle of this.
So true.
Talent Transformation webcasts are brought to you by the Talent Transformation Guild to help you understand and prepare for the new world of work.
Hello, I'm Eric Shepherd, and I will be the host of today's Talk Forth podcast, along with my friend and co-founder of the Talent Transformation Guild, Martin Belton.
Hi there.
So today we're all having to come to terms with the effects and challenges of COVID-19. But one thing we've learned during this terrible pandemic is just how powerful analytics have been in the fight to contain this virus and flatten the curve. So I'm delighted today to be joined by Chris Moore, President and CEO of workforce analytics organization ZeroedIn. I'm going to be asking Chris about how analytics will be used in the boardroom and throughout their organization and throughout organizations during the COVID-19 outbreak and beyond.
Great to be here.
But first, I'd like to turn to our other guests today that join us from HealthStream. Greg Glockman, Vice President and General Manager for People and Growth Solutions, and Jennifer Hamrick, Product Manager of People and Growth Solutions, both from the leading healthcare learning provider, HealthStream. Welcome, everyone.
Thank you, Eric.
Thank you for having us.
Great to be here.
You're very welcome. You guys are right on the leading edge of things, and so fascinated to listen to what's going on. Be great if we could have you introduce yourself. Maybe we could start off with you, Jennifer, go to Greg, and then Chris.
Absolutely. Well, thank you again for having us. Excited to be here. My name is Jenny Hamrick. Like Eric mentioned, I'm the product manager for data visualization and learning analytics at HealthStream. So a big part of my day-to-day job is helping our customers leverage their own data as well as data we can make available to them to help solve business problems. So with everything going on with COVID right now, that's looked like an hour-by-hour sort of benchmark checking in with our clients about what learning and activity data they need, as well as how they can leverage some of the caseload data available, as well as other things the CDC is bringing to the table to help solve this pandemic as quickly as possible.
That's great. Thank you. Greg.
And thanks, Eric. Great to be here this morning. As General Manager and Vice President for HealthStream's People and Growth Solutions Group, I oversee our learning management, talent, performance, compliance, and revenue cycle assets. And so in the past 45 days, we've marshaled our learning management system and a lot of our course content in the clinical, compliance, patient safety areas to really try to make an impact. We work with about 70% of all hospitals in the United States, and we have 5 million healthcare workers coming in and out of our system on a regular basis to do work. The numbers that we've seen in the past 2 months have just been incredible. We're achieving all-time records in healthcare workers coming into our system to learn not only what they need to do to care for their patients, but also to just protect themselves. And so we are really trying to expose data to our customers and now actually to all 50 states as they're standing up temporary healthcare facilities to handle the overflow, so that we're really helping states and individual hospital networks model where and what they need to teach their team members in order to create the biggest impact.
That's great.
Great.
Before I let Chris go, Greg, I have to thank you and all your team for doing what you're doing. It's tremendous. And having run a software as a service company and knowing what it's like to have to scale up quickly, clearly you had the right technologies, the right philosophies in place so that the increased load that came in to deal with this pandemic, you guys could handle. So I tip my hat to you.
I appreciate that, Eric. You know, I tip my hat to the executive team and everyone that we work with. You know, starting 30 days ago, we met and said, how can we take the content that we believe from what we're learning out of China and now Italy and South Korea at that point, what could make the greatest impact? And we started making it available for free. And then all of a sudden we saw people just coming into the system, and these weren't hospitals. These were individual nurses and respiratory techs and other folks who said, I need this info to stay safe. I need the information right now.
Mm-hmm.
And then we said, okay, how can we scale this up? And so basically, over about a 4-week period, we were in contact with Microsoft and AWS and others to say, how can you help us scale this information now? So it's been an incredible journey, and I'm very thankful to be part of an organization who leads with how do we help give back to the market we serve, and we'll figure out the economics later.
That's great. That's great. And great to have such great suppliers as AWS and Microsoft. We're lucky in many respects that we're dealing with this crisis when we have all of this infrastructure around, that these guys have been scaling up over the last few years. We'd certainly be in a more challenging position if this had happened 10 years ago, to just push people to work and try and work out these analytics. And so we're lucky in that respect if there's one blessing we can count. Let me now turn to Chris.
Great, thanks, Eric. So hi everybody. I'm Chris Moore. I'm the CEO and founder of ZeroedIn. We're a workforce analytics cloud solution company. And what we really do best is help our clients make better use of their people data. And our focus is really helping HR leaders to anticipate disruptions in their workforce and then really monetize from an ROI perspective their data science activities. So we've teamed with HealthStream. We've been working with them almost for the better part of almost 2 years now. And more recently have really begun focusing on this COVID pandemic, their ability to help healthcare providers prepare their staff for it, cross-train, upskill, and then actually compare that activity and correlate that activity to COVID case runs and death rates and of infection rates across the geographical areas that they serve. So they're happy to share some of that today.
Yeah, and Chris, you and I have known each other for a long time, and we can see, I think, just as I said about the providers, how individuals have developed their knowledge, skills, abilities in order to bring the kind of analytics to bear quickly. Without that kind of experience and depth of understanding, it would be difficult to do that. So thank you.
Yeah.
The changes brought about by COVID-19 are clearly seismic. And we'd like to kind of understand some of the tools and solutions that people are providing to either accelerate solutions or speed up the process or slow down the process. And so these new technologies, they're empowering every corner of our life. But in the real world, I wonder how this is showing up. I'd like to ask each of you the same question here. How are you seeing new technologies and analytics changing your work and changing the work of the organizations that you support?
Sure. So, I'll kind of just lead initially from the analytics side and then kind of turn it over to Greg and Jenny. But, clients need to, organizations need to make accurate decisions quickly, not just in times of crisis, but almost on a daily operational basis. Innovation, progress, it's moving faster than ever today, and there's no time for indecisive management if you want to compete and succeed successfully. So you hear CEOs say our most important asset is our people. From an HR practitioner standpoint, then you have to think that really your most important asset is your people data, right? So you can use that to make better decisions. You can't rely on your gut feeling all the time and what you visually see. It's in times of uncertainty where you need to be prepared. You need to have the facts so that you can make decisions. So, today's technology and the technology that we're bringing to market can take current data and historical data, apply it into a statistical model, and really provide live analytics.
That's great, Greg.
And just playing off what Chris just said, I couldn't agree more. As a learning company, we've been focused for 29 years on how to provide the best training and competency development and career pathing for healthcare workers. And healthcare is a very data-rich, but at times intelligence-poor industry. And that data ends up locked up in multiple systems. And when you need it the most, it's hard to get it out. And so in times where stress is low, we've been really working with our organizations to say, tell us more about your people, not just what department they work in. Give us some information about their age. Let us help understand what generation they're a part of, because that impacts how they may desire to learn, what their level of engagement is, the outcomes they're achieving in quality and safety and patient experience. Let's use that data to create individualized career development and learning pathways. And by doing that, we're able to tackle one of the biggest business objectives in healthcare, which is the elimination of waste. For an industry, especially in the United States, that only sees its revenues increase about 2% year over year, we're talking razor thin margins. Any investment that needs to be made has to be made based on the idea of how does it give people back time. Time to be at the bedside where we're caring for patients, time to be with patients as customers where we're generating revenues, or even time just to give back to an individual so that they can invest in themselves. For us, that's not possible if you don't have data about your people. Otherwise, you're shooting from the hip, and you'll only know the return on investment you made in developing your people when it's too late to course correct.
That's great. Thank you. Jennifer.
I mean, following right along with what Greg said, I think on a really tactical level, we are seeing a move towards operationalizing and automating a lot of processes. So with budgets being cut significantly, especially during this pandemic, there are less resources, less people, but there's also now energy needed to be applied to other, what the organization sees as more mission critical activities. So from an analytics perspective, we are seeing an additional pressure to provide operational support, automating processes that traditionally maybe had a component of the component that was managed maybe by individuals now that we're looking to manage solely through some of the solutions that we're providing. And then the piece of how efficient can we make those. So ramping up speed as quickly as possible is also very important.
Mm-hmm. That makes a lot of sense. Just referencing one of the comments you made, Greg, about being data rich but intelligence poor. I often feel that about when I see the COVID-19 data, in that I feel like I'm watching a leaderboard, like who's number one and who's number two. And it shocks me and it worries me, but to me, it's not actionable. And of course, you've actually got to, and Jennifer and your team and our healthcare workers have to make the data actionable. And so, I'm thinking, how do you and others, whoever wants to pick this one up first, how are you seeing COVID-19 data being used to inform decision-making?
I can jump in there. So two of the big things we're seeing is measuring staff preparedness. So we're looking at a lot of the training programming that's in place or that we're providing now as a way to measure staff preparedness. And from that, then we're bringing in things like, okay, what is the infection rate of that staff, right? As a leading indicator of what could be future movement towards growth or reduction of the spread. The second big thing that we're seeing from a data perspective is leveraging information about the individual providers as a way to understand upskill and reskill opportunities. So one of the biggest things our clients are facing right now is staffing shortages and then distribution challenges, right? So as cases grow in a particular county or a particular area, they need to move resources really quickly in order to address the repercussions of that. And so having a really holistic picture and understanding what types of individuals and what types of roles are in each of these areas allows them to make decisions about staffing allocations, reskilling, upskilling, and movement.
Understood. Thank you.
I would just add to that, one of the other challenges that we've had in terms of using data and coaching our customers through it is the models that you're hearing presented nationally change on a regular basis. And with our customers not always having strong data fluency in understanding the models, and so part of what we're coaching our customers on is models are only good as the data that's feeding them at the moment. And I think one of the guarantees that you can always point to is the model will always be proved wrong if you're trying to look at a finite number. Mm-hmm. And so how do you look at the modeling around COVID and look at the ranges that are being presented and say the ranges give you the direction follow the direction. And so a lot of our follow-up with customers has been around looking at the direction of where the models are going. How do you use that to flex not only in training and, to Jennifer's point, upskilling and reskilling numbers, but how then you communicate that through your organization so that everyone is on the same page with the direction the model is going, and you don't have staff members, managers, administrators, ultimately looking at the same model or the same data and then trying to drive different conclusions and different strategies.
Got it. Yep, that makes sense.
Yeah, it's probably a good segue, Greg and Jenny, if it's okay, I'll just share quickly, what some of that, at a very high level, what some of that data can look like for your clients.
That'd be great.
Yeah, so you'll see here, you should be able to see my screen, I think. ZeroedIn has teamed with HealthStream to really bring together both internal learning related activity as it relates to, in this case, COVID, and other related topics, and then see the trends that the rollout and the engagement in that activity has in actual case infection rates, case drops, death rates, and so on. So it's just a quick visual, looking at everything from training assigned, people who self-enroll, looking at that over time, seeing trends in correlation to the spread in those same geographic areas. So it's something that's live, interactive for HealthStream clients, particularly the groups that are managing those resources who are on the front lines. And then outside of the healthcare arena, you're right. It's kind of like the leaderboard, but I believe that employers can use that to plan a timeline for a return to work. Right? It gives them insight as to whether the virus is spreading or contracting in the areas where their employees are located, and they're also making temporary changes to their leave policies. They're bringing people back on with premium pay. There's new laws that employers, some of them are financially liable for the time off related to FMLA and the expansion there. So those transmission and case numbers, that leaderboard can help gauge and calculate their time to limit financial exposure or lack of finances coming in. Finances are the lifeblood of a business, not just small businesses, but the large ones. So, we've also been looking in conjunction with HealthStream at CDC measures, the Institute of Health Metrics and Evaluation at University of Washington, to see if we can capture spread actually within the healthcare organizations itself, not just the geographic population. So that really becomes valuable for HealthStream clients, because it really shows that the investment they're making in the training and education are paying off specifically to the people they're responsible for.
Yeah, Chris, I couldn't agree more. The single data point that we're looking at the most is assigned learning versus elective learning. How often are people taking these courses because their employer, the healthcare entity, has assigned them, versus how often are they going and finding these courses on their own and taking them on their own? And that tells you how just how serious this is, because most of the learning that goes on in healthcare is a traditional assigned model. It tells you how dire the situation is, and it's also a reminder to employers, you have a responsibility to provide the information that your employees need to keep themselves safe.
Chris, when we looked at the dashboard, there was seemed to be a number of data feeds there. Could you give us some insights into where you harvest the data from to present those kind of dashboards?
Sure. Well, the learning activity data is being harvested from HealthStream's Learning Center, where we're connected to that. And then we're also pulling the COVID-related activity data from the New York Times. They've published their data sets out on GitHub, so we've been pulling that in.
That's great. And we've seen some amazing online analytics models. I think the Washington Post did one to reveal how self-isolation really works. So what other models, analytics, and methods are you seeing or using to help employees manage their health, safety, or work during the current pandemic?
I would say, from HealthStream's standpoint, the models that we're really looking at is to, through FEMA and CDC protocols, to say what are the job descriptions, what are the types of healthcare workers that you need, and based on our understanding of what those types of healthcare workers would have learned historically in their role. So, take an example: a nurse in a medical unit, a step-down unit. That nurse has a group of core competencies that she or he would have learned. What would be the gaps we would need to upskill them to so they could move from a lower acuity unit into a higher acuity unit like an ICU? What would be the lag in knowledge, or knowledge loss from the standpoint of when someone retires? And if we are reactivating healthcare clinicians who have retired in the past year, how much learning do they need to rapidly to get to the bedside? How is that different from somebody who's been retired for more than a year or more than 5 years? So it's a really interesting time. We're looking at models around retention of knowledge. We're looking at models around cross-training or upskilling to say what is the most efficient way based on what we understand about your current learning to get you to where we need you to practice immediately.
Sorry, I was going to, can I just ask a quick question? And really I was originally asking this to Greg, but I guess it really to anybody. I was just curious, have you seen a kind of change in attitude at all from your clients when it comes to sharing data and information? And has this changed during the recent crisis?
That's a great question. This is one of the things that I love about working in healthcare. And I've been in the industry 20 years. It's the only professional industry that I've known. I actually started as an EMT long time ago, doing volunteer ambulance work. Even in a market like the United States, which does focus on bottom line, and you have for-profits and non-for-profits competing for healthcare household spends in different areas, in a time of crisis, everyone comes together. And so it's been amazing because this information is so dynamic and we're learning things about the virus literally on a week-to-week basis, if not day-to-day. People have literally opened up their resources. So having a learning management system, we're not just providing content that we create or other institutions create. We also give our customers the tools to build their own curriculum. And so we've had organizations put their hand up and say, we just created a series of videos on how to manage triage in a parking lot and how to quickly segment folks coming in so that you can fast track people to an ED who have non-COVID related cases, how you can test and then quickly transport people who have a high likelihood of being COVID positive while you're waiting for test results. People have built assets and then said, please share them broadly. That does not normally happen when there isn't a crisis. And I think it's something very unique, again, about healthcare. We all have a mission to serve. And when called upon, that's the first thing that we lead with.
Great.
That's great. So Jennifer, I think I cut you off. Did you have something to say?
Oh, no, just going back to, what new other analytical models we're seeing daily, if not hourly. CMS and, states are making changes, regulatory changes specifically to scope of practice and licensure. So in the time of a pandemic, we're short-staffed, who can do what within the healthcare arena. And so we're seeing a lot of need for models that predict what your current staffing supply looks like as it's opposed to what the changes are. So that way you can say, hey, a physician assistant in the state of Michigan now can practice without a physician supervising them. So you can distribute physicians and physician assistants over 2 different facilities. And so just lots of needs for models that understand the regulatory changes that are being made. They're happening so quickly. We saw 126 changes over the last week just in response to the COVID pandemic. And so our clients need that data really quickly in order to start making some of these decisions.
When we look at what's been happening over the last 6 weeks or so, projects that were going to take months and months to implement have suddenly been done in days. So we've seen the scale up of Zoom conferencing or Microsoft Teams, and it sounds that you are also being pushed by that wave, and so scrambling just to make things happen. Do you think that's going to change the way we think in the future, as far as there's a more can-do attitude towards change management? It's like that project that we had that was 6-month rollout of this thing, we now can do much more quickly because you guys have proven to do it. Or what are the drivers behind? We know what the drivers are at the moment behind change management. Do you think things are going to change in the future?
I hope so.
Yeah.
Me too.
I do think crisis tends to lend itself to more focus. At least I know internally at HealthStream, we've been able to be very laser focused on, and our board gave us a really clear mandate of these are the 3 things we need to be doing daily, and every activity we're doing needs to be focused on those 3 things. So we've seen, we've been incredibly effective because we've had that laser focus. So I hope that continues.
Our board directive, we have clinical and non-clinical board members, was very, very clear. Find solutions that help with things like virtual connection, virtual training, virtual development. Find solutions that help fast track training and people to the right areas to provide care to COVID. And the third and most important one, and this was near and dear to my heart, remove all red tape. Now is not the time to turn around and create complexities with contracting language. Just get things into the hands of people that need them. And so where, we've marshaled our resources together within HealthStream, and we've reached out to suppliers for help. We also have over 95 partners within our network who provide content, and a number of these partners and application partners like ZeroedIn said, you know what, let's just get to the point. We need to arm people with the right information and the right development assets. Let's get it out there. We'll worry about intellectual property. We'll worry about distribution rights and everything later. I am a bit more pessimistic than Jenny in terms of what this looks like 12 months from now, because one of the things that I've seen in my career in healthcare is we suffer from very quick amnesia. And we are a highly regulated, always on, and change resistant industry. And we see pockets of innovation on a regular basis. We can marshal resources quickly in areas like a global pandemic or a crisis. But once that pressure drops, we go back to status quo very fast. And I think the challenge here, and I know within HealthStream and with our partner ZeroedIn, one of the mantras that we're really asking ourselves is, how do we make this the new normal? And not just because we were able to do things that would normally have taken 12 months to roll out in 4 weeks. We also know that COVID-19 is not going to be the last pandemic. And we have every expectation that the healthcare system, not just in the United States, but across the world, is going to be pressured more regularly with incidences like this. So then the question is, how do we learn from this and make it part of a new state of readiness? And I think that's a big challenge for change management, because people want to return to normal. This is our new normal.
Yeah, I think you're right, Greg. It's there will be a COVID-20, right? And for those that didn't know, the 19 is related to 2019 when the pandemic actually started, or the virus was designated. But I think you're right. Priorities change over time and in times of crisis, and I think there'll be an opportunity to step back and say, okay, was that really a priority to begin with? And people move quicker. So there will undoubtedly be, as a result of the rise in, the release of regulation perhaps, and the speed at which people are moving, there's going to be some mistakes that have been made. And people, organizations will have to weigh, the value, and maybe that's not the right term, but the cost benefit there of the mistakes to the outcomes. Is it, is this acceptable? right? Is there an acceptable error rate in this new normal that we can continue at certain speeds and without, with new priorities?
That makes a lot of sense. And I think when leadership provides that focus, as Greg was saying, it's easy to get things done and cut through the red tape. When we get away from a common enemy being COVID and COVID-19, and the focus broadens, then it's more difficult to please everyone. So go ahead.
Yeah, no, I think and that kind of leads, what happens after COVID-19, if, when it's behind us, and what do people focus on? And I believe that as a result of what they're looking at today, they're going to continue this analysis and understanding of, where and how people work. Eric, you did a great job in the recent blog post about coronavirus analytics as to, how many people can work from home, how many people are already working from home, and so on. And, there'll be a closer look at what they know, what jobs they're capable of doing. Even if it's not their primary job, we're seeing this in the retail where they're moving people into distribution and able to get people, product out quicker, refabrication of plants to produce new goods. So there's going to be a lot of focus on, on change and rapid change.
And I think a lot of organizations will be empowered by how agile they were during the crisis. And they might even refer back as a lesson learned. So remember what we did in the crisis? Well, we can do it here too. Let's put our agile hats on and just get on and get this done. So hopefully that will be some of the future. Jennifer, let me turn to you. How do you see the future after the pandemic as becoming a distant memory?
No, Eric, that's a great question. Greg spoke a little bit about data fluency, and I think that piece is huge. We have so many organizations right now needing to make critical decisions with a lack of data or data in different places or with different systems, et cetera. And so when they go, when they're having hourly meetings, right, trying to bring all this together, they don't have it. And so I think what we will see is a need for more consistent data that's readily available, and then an organizational priority to do whatever it needs to happen to make that the case. Because in times of crisis, what we have learned through this is that if it's not available, you do have to fly by the seat of your pants and hope to make a decision that's the right one. But I do think organizations are seeing the importance of being data fluent, of collecting the right data at the right time, and then having consistent processes in order to maintain that, which I think is great.
That makes a lot of sense. Yes. So just on my last question here, because we're coming to the end, running out of time, but so we're going to have these massive pools of data, maybe still siloed, but accessed from dashboarding and analytic systems. Do you see artificial intelligence, machine learning playing into that to help derive that intelligence from this data that hopefully we're collecting at the right time, at the right place?
Yeah, definitely. I mean, even today with HealthStream, ZeroedIn is using AI and machine learning to predict outcomes in terms of pass-fail rates in learning, looking into the future, looking to streamline paths towards compliance. Greg can talk a little bit about that. His healthcare providers spend a lot of time and effort managing, those efforts with their employees. And then we're also looking into the future of prototyping with AI models that indicate how effectively people work based on how they learn, looking at the way they pace themselves through, a block of courses, and, are they procrastinators? Are they overachievers? And then taking those models and saying, well, okay, when somebody has a project with deliverables, do they work similarly?
Great.
Eric,
so AI is very helpful with that.
Eric, you talked about common enemies, and now it's COVID. Going forward, our common enemy is, I talked about lack of resources. People are resource strapped. It's also a major demographic shift in our workforce. And so as we're seeing baby boomers retiring in droves, we know that in the United States, we are going to be short hundreds of thousands of nurses on the coasts. However, based on current modeling, we will actually have a surplus of nurses in the middle of the United States. We will be short on physicians based on different types and needs. And so for us, we're looking at AI and machine learning to say, how do we look at the behaviors of all healthcare workers, how they learn, how they develop in career paths, how they select what shifts they want, how do they engage with each other, how do they recognize each other, how do they develop commitment to organizations, and pull all of that data into models at scale so that an institution knows, if this is my workforce today, what are my workforce needs in 3, 5, 10 years? Right. If these are my new nursing grads and new physician grads, who will be the next leader on the floor? Who will be the next chief of staff? And what type of options and choice, I think that's the key word here, what choice can we give people in their learning journey so they stay engaged, they stay high performant, and then they can pass knowledge on. You can't do that at scale when you're a nurse manager and you have oversight over 100 nurses, many of which you've never even looked in the eye because they work third shift at night. You can only do these things if you're applying artificial intelligence and machine learning. So I think this is, there has been a wake-up call in the healthcare industry. In order to scale, we need to use machine learning and we need AI. In order to use those properly, we need access to data. And sometimes it takes a crisis to break down the walls inside a hospital or even the walls inside a vendor to make all of that readily available. And so that is what I do hope we learn coming out of this.
That's great. Thank you.
Like, Eric, can I just ask another question, actually? And really on the back of that, the adoption of AI, I think in the UK, we've also seen that this really is a worldwide issue. And so we seem to spend a lot of time looking at other countries, working out how they're responding to coronavirus, worrying about their moves. I was just kind of wondering, do you see what you're going to do now and the sharing of information, working with the clients, getting more solutions? Will you be looking to work on a more worldwide basis? Will you be forming partnerships on a much wider basis now? And how will that help you?
That is a great question. We've been working with learners across, I think, about over 30 countries over our history. And this has been traditionally focused in our area of resuscitation training. So we're one of the largest resuscitation trainers in North America, and we've actually extended that content out into other countries. The workforce is global. And when we look at nurses, for example, in the United States, and physicians, a lot of these workers did not originally come from the United States. So we're bringing in healthcare talent from other countries. Well, then other countries are bringing in American healthcare standards through organizations like Joint Commission and IHI, the Institute for Healthcare Improvement. So I think as standards of quality go global, as the workforce becomes global, it's a logical extension that learning and development and the data about how people most effectively learn starts to become a global pool of knowledge. So I am hopeful that, again, we will continue to spread and work with organizations across not just the United States and Canada, but more broadly as well.
Very good. Well, unfortunately, we've run out of time. Your insights were tremendous. I know you all have important work to do in carrying on with the work that you've been doing, but thank you so much for just sharing your insights at this moment in our history. So thank you, Greg, thank you, Jennifer, and thank you, Chris. Just to finish up, this webcast was brought to you by the Talent Transformation Guild. And if you'd like to know more about the Talent Transformation Guild, then please go to talenttransformation.com and please subscribe. Thank you, and thank you all.
Thank you, Eric.
Thank you all.
Thanks.
You too. Perfect.
Thank you for listening. If you have enjoyed this webcast, please subscribe and like the show. And to learn and understand more about the new world of work, please visit www.talenttransformation.com. Subscribe and become a member. Thank you.